Welcome to Right Here, Right Now. Today we take you to the front lines of the COVID war. My guest, Meghana Satpute, is a registered nurse at the Santa Clara Valley Medical Center in San Jose for the past 10 years. As a nurse in the medical intensive care unit of the hospital, she has seen advanced COVID patients. She has seen this disease unfold and claim many lives. Let's talk to her. Let's get to the heart of it. Hi, Meghana. Welcome to the show.
Hi, Archita. Thanks for making me a part of your show.
Absolutely. It's a pleasure to have you here. Tell us a little bit about yourself and how did you become a nurse?
So first of all, my full name is Meghana Satpute, and I was raised in India, and I came here about 20 years ago in 2001. I got married, I came here. Before coming here, I was working actually as an interior designer in India. And then when I came here, I started exploring my options of what to do further. I already have a cousin here who's a nurse anesthetist in Michigan, and I happened to visit her in Michigan, and she kind of inspired me to be a nurse anesthetist, and that's how I started my new adventure of becoming a nurse. So I went to San Jose State University. I got my bachelor's in nursing in 2009, and as soon as I graduated, I was hired at Santa Clara Valley Medical Center, and I've been working there for more than 10 years as an ICU nurse now.
Wonderful.
Yeah.
So ever since COVID has broken and pandemic has hit us, what has your experience been as a nurse? This isn't something that you've seen in your lifetime probably before, and even as your experience as a nurse, I mean, just can you walk us through how the experience was ever since it became large and affected all our lives?
Right. First of all, like me and all my fellow workers, we are still amazed that, this is happening in our lifetime. And then we are on the front line being a part of it. I think when it started initially, there was so much contradicting news about in China where it said that it's probably not a human-to-human contagious infection, but then because there was no evidence, and then soon after that, when it started appearing that it was more due to human contact and it's an airborne infection, then that's the time I think we started getting a little worried and started thinking that this may come to us soon. Even actually when it was in China, we were not so sure whether it will come to US, but within no time it was here, and by that time I think everything had changed. The hospital had already started preparing. There were huge tents outside. They had started preparing for extra room, and they had started training us on how to use PPE, and then it all just started. We don't even know how it just began. Yeah.
And walk us through your day as a nurse as well. I mean, from the time that you drive in, I believe that the PPE, all the gear is really hard to wear for 12-hour shifts. And how does your day look like in terms of when you get in? And being an ICU nurse, I believe you probably have different protocols, I would imagine.
First of all, a normal day, which is now, which is different, is as soon as I park my car, we go into a certain building before we enter the main building, main hospital building, and where we get screened, which is basically they check our temperature and they give us a mask, a regular surgical mask, and they give us a sticker, which is basically saying that you're fever free and you can enter the hospital. And this is happening every day, and I'm guessing they're going to keep doing it for the next few days or months, I would say. Then once I enter my unit and we get shift report, which is a change of shift, I get report from the previous nurse. And then starts the day, which is most of our time is spent in getting ready to go into a patient's room, which consists of basically I have to wear a gown, gloves, cover my hair. The main thing is the N95 mask and a shield on top. And then it's not only about wearing, but it's also a lot about planning and organizing and clustering my care before I enter the patient's room, because I don't want to make too many trips going back and forth. So basically going in, doing that, and I do that for 12 hours, and it takes more time to leave the patient's room Also, like while I'm in the patient's room, I'm constantly worried, should I touch this? Should I not touch this? Or should I change gloves now? So I'm always thinking at the back of my mind. And then while leaving the patient's room, I almost go through 4 to 5 set of gloves and 4 times of hand washing and hand scrubbing to make sure that I have removed everything according to the right protocol. So that's basically my day right now in terms of wearing PPE and making sure I don't touch anything, washing hands and disinfecting and all equipments and all surfaces and making sure it's free of contamination. And I think that's about it mainly right now.
Right.
Yeah.
Is there still a shortage of the PPE, like masks and gloves, and because all this while we've been hearing about the shortage here in California, New York, and everywhere else as well. But I do believe we have kind of turned the corner and we've been shipping out PPE for other states and especially New York from California.
Yes, that's correct. I don't think I've had a single day at work where I've not had a mask or not had the right gear or the right equipment I need to use. Like I do agree that they're just trying to ration out everything in case there is a swarm of patients coming later or there's a sudden peak later. So they're just trying to make sure we have enough, but there has never been a shortage. And thankfully, we've had a lot of donations from, I think, a lot of tech companies and other private donations. So I think we are okay for now and there's no shortage as such. We are good.
Well, that's good to hear.
Yeah.
Yes. Can you comment a little bit about that's something that's been on my mind about the mental health of doctors and nurses, frontline workers, given the scenario post-COVID world? I mean, do you see anything? And how do you guys cope up?
So right now, we are not seeing much because we've been, about a month and a half into it. It started about, I would say, March. It's
Hmm.
almost 2 months now. And there's so much new to learn every day, new policies and procedures of how to wear this or how to not wear this. Or we have nurse educators all over the hospital that are constantly training us. So right now it's a lot of information, a lot of training happening at the same time. I do agree it is physically very tiring, mentally very taxing. Emotionally also it's very hard. And the biggest thing is, wearing a mask all day, it's very hard to talk, it's suffocating, it's hot. You're wearing so many layers, it does get hot and that also is exhausting. Um, so right now, I think most of the nurses, as far as I've seen, seem to be okay. We are a really good team at work, so we are very supportive of each other. And I have to say, luckily, at least in our hospital, I can't say for other hospitals, but at our hospital, they do regular debriefing sessions where all the nurses basically sit together and then we have a social worker, a psychologist, a chaplain, and we all talk about our problems, our fears, our anxieties and emotions. So basically, we just went out and we just discuss how we can do this better and how we can support each other. So I think those debriefing sessions have been very good. And I'm hoping they will keep doing it. At least for now, they're doing one. Actually, there's one scheduled for April 22nd, which was actually, sorry, I missed it because I was off from work. But we always schedule it on a regular basis.
Okay, that's great. What can you tell us about plasma therapy?
Plasma therapy is, we just started this doing recently. Plasma therapy basically is a convalescent plasma study, and it's a very old study which was done many years ago, where the antibodies of patients who have been through COVID and who've been cured, not cured, I would say, who have built immunity, their plasma is taken and given to COVID positive patients to see if they can build the same immunity against the infection. We have given this last week to 3 other patients, but not sure about the timeline when we will be able to see the results. So we're still hoping that we'll have a good outcome and hoping something will work and help these patients.
Are you hearing any positive news from other places in the country that which are also into plasma therapy or from other doctors, other hospitals?
I haven't heard actually much from other hospitals, but I've just seen in the news and read in the news that some places in Chicago or some hospitals in Chicago have tried the therapy and it has
Mm-hmm.
seemed to work.
Mm-hmm.
There are also new drugs coming which we haven't used, but they seem to be very promising. So we are hoping that there will be some treatment coming up soon or some vaccine.
What are some of the biggest impacts you envision in healthcare industry in the upcoming few months once there is a soft opening and easing of the rules?
So with the soft opening coming up, there has been a lot of discussion at work, and there are two things to it. First of all, like I've heard stories about Sweden or let's say even New York. I think in New York, 1 in every 5 person has already been infected. So I have to say they're kind of over it or they're done. Or like in Sweden where they tried to build a herd immunity and they did not wear masks and they were in contact with each other. And even though there were a lot of deaths and a lot of infections, at least there's no social distancing or they're not following anything. Out here in Bay Area, we are fearing that since the lockdown and the shelter in place
Mm-hmm.
was kind of initiated at a good time, and all the communities have been very good about following the social distancing and isolation. So not many people are exposed. But now the rumor, or not the rumor, but they're saying that they're going to do a soft opening or they're going to start doing the most like important like surgeries, like people with heart conditions or who've been waiting for a surgery for a long time. So we are worried at work that those people are going to get exposed, or those are the ones who are they're highly susceptible to get this infection. And then we may see a big surge of cases then, maybe about 2 or 3 weeks from now, depending um, on the opening date.
How has the preparedness been in general at the hospitals?
I think preparedness, I can say at least for the county hospital that I work for, I think it's pretty impressive. Right in the first few days or weeks, they already had numerous tents set outside, which are showers and tents, which are all well equipped. They have ventilators ready. Even the different units have hired a bunch of extra nurses, which are called as travel nurses, who are like temporary nurses on contract basis, in case we run out of nurses or there's a shortage. Apart from that, I think in terms of PPEs and stuff, I think they're trying to stock up and make sure that we have everything. I think, and then the Santa Clara Convention Center, I don't know if that's part of the county thing, but I've seen pictures and it is all ready to go. I've seen pictures where they're like literally 200 or 300 beds with all the equipment there. So I think they've done a good job. They're ready. They are prepared, and hoping that it does not become chaotic or cause a disaster as it was in New York.
Yes, definitely. Hope so. And what uh, is your typical day outside of being a nurse look like? I mean, your mom, and has the 12-hour shift kind of affected your personal life and this taking a toll on just your, normal activities?
Oh, well, like just all of the other people who are not in the healthcare industry. I'm a mom at home. I'm cooking, cleaning, and I have an 8-year-old at home. Homeschooling, trying to do outdoor stuff with him, going for walks or bike rides, trying to keep myself healthy. I try to run, walk, hike on my days off, trying to do much as I can. And honestly, there's not much time left because when you do a 12-hour shift right now, which is temporary situation, you don't have much time left because you're so tired. You come home basically and you're ready to I just get up and go. I just get up and go. I just keep plugging in. So that's what's happening on the personal front.
Right, right. And I heard something about children of healthcare workers kind of not being able to go to camps. Is that true? Because of the exposure?
So
Summer
I don't know
camps
about
and things like that.
right, right. I don't know about children right now, but I would say my husband, he works for a startup biotech company in Fremont, and I know that their president or CEO made an announcement that if your spouse is a healthcare worker, then they're not allowed to come to work to prevent or like protect the other employees from getting infected, because there's a lot of employees who are above like in the 60s. So that makes kind of sense. And personally, as far as summer camps or any other school activities for my son, I just want to be careful. We just want to be careful as a family and make sure that we don't spread it. Like I'm not saying I have it, but
Right.
I'm the biggest risk for my family right now. And I don't know if I have the virus right now or if I get it in the future, but they are the biggest, they're highly exposed to me since I'm at home.
Right.
So that's why we are avoiding to sign him up for any summer camps or any other activities, which
Any other?
involves a lot of,
Yeah,
yeah.
yeah. Because the schools are closed, but I think the facilities are sort of open for essential service workers, right?
Absolutely.
Yeah. What does your ICU look like right now versus a typical day before the pandemic? What are the differences that you're seeing right now in terms of cases that are coming in?
Okay. So the biggest thing is, first of all, I work in a medical ICU,
Hmm.
and since this began, we basically have 4 ICUs in our hospital: the medical, surgical, trauma, and CCU, which is coronary care. And so what they have done is to separate the COVID patients from the regular ICU patients. They've opened up a separate ICU just for COVID patients, and that's where I work 90% of the time. So this ICU is only patients who are positive and very high risk. These are very, very sick patients, most of them being on ventilators. And I would say the biggest difference is, let me think about, just I would say starting from everything in terms of treatment. The treatment is very different because these patients are so sick and their lungs are getting so worst that we are seeing more of these patients. We have to paralyze them so that they can breathe properly, or they are on different kinds of equipment, which is hard to explain
Hmm.
on
For sure.
interview because people will not understand.
Yeah.
But a lot of equipment is used for better ventilation for them,
Hmm.
which we don't see very often in a regular ICU. Like it's not that we don't see them at all, but it's just
Got
very rare, definitely. So there's only one case maybe once in a while who's so sick, but these ICU patients, the COVID patients, they are really, really sick. So that's the biggest difference, their treatment and how the acuity of their sickness.
it. And the lungs, I believe, it looks very stiff, right? Compared to
Yes.
what you've seen
So what
before.
COVID does to your lungs is it's really sad because it stiffens your lungs and it builds up fluid in the lungs, and also definitely the ICU patients we have are at such a later stage, or the disease has progressed so much that they're not able to breathe on their own. Obviously, that's why they're on the ventilator. And also, like in terms of, let's say, we draw a lot of labs, right, for all these patients. So the regular ICU patients, like in COVID positive patients, we are seeing that their blood is clotting faster, or their blood gases are different.
Hmm.
So we don't see this in the regular ICU patients. Like not every patient has a very elevated, there's a lab called, we do D dimer, which tests for blood clotting. So we don't see that in regular patients. So these are the biggest differences we are seeing in the COVID patients. Yeah.
I read a report about oxygen levels not going down initially for the COVID patients, right? And then uh, apparently it suddenly drops. So, did can you comment a little bit about that?
Right. So I think what is happening is the COVID patients that, by the way, the ones that come in the ICU, they have already worsened or they're really
Right.
sicker. They've come from other floors.
Hmm.
So their oxygen level is already, or oxygen saturation is already very low.
Right.
Or and that's why we have to either put them on a ventilator or we have to try other options. But the symptoms for COVID, basically, it's a wide range in the sense there's a range where starting from the lowest level where some have no symptoms, some of them have a low oxygen saturation, but they look normal. And then there are some patients who come in with the classic symptoms, which is fever or I think diarrhea for a week or really, really bad shortness of breath. And then I think having on top of that, if you have any lung issues or if you're a smoker, if you have asthma, any chronic bronchitis or any issues, it just makes everything worse. So I think we see a wide range of symptoms, and some of them literally they can't even they don't have much, and those patients are actually even sent home. They're sent home from the ER. They don't necessarily get admitted, or they go to just the primary health clinic and they're tested and told to isolate and quarantine, and some are fine. But there's no way to find out why some patients are so badly affected by it, and some of them nothing absolutely happens. It's a real mystery how it works.
And how about the testings? Do we have enough testing out there?
I think so. I think there's enough testing. In the beginning, I remember it was taking like 2 days or 3 days for the test to come back. But now I think it's like 3 hours or so. It's really fast. So I think testing is not a problem at all.
Okay.
For the patient. Yeah.
Okay. Well, you pretty much answered everything I had for you. Thank you so much, Meghna, for all the work that you do and your entire team and all the other frontline professionals. Yeah, just kudos to you guys. And thank you for giving us your precious time.
Thank you, Archita. Thank you for being part of the show. It was great talking to you.
Same here.